Welcome to this special health feature, presented by InfoNews Media TV, where we explore critical topics shaping modern medicine and patient care. Wegovy users adjust doses themselves. It's the Wild West. Experts warn against self-adjusting doses without consulting a doctor, but they understand why patients do it. Wegovy, a popular weight loss drug, comes in pens with a dial offering a 4-week supply. Official dose markings are at 0.25 milligrams, 0.5 milligrams, 1 milligram, and 2 mg. But users quickly figured out how many clicks equal a milligram, enabling them to self-adjust doses. Some users reduce the dosage to avoid side effects or to save money. Some even say they wouldn't have started the medication if they couldn't adjust the dose themselves, because the cost would be too high. In some cases, general practitioners have recommended the method, despite it going against the official prescribing guidelines, while others have advised against it. It's the Wild West. Maria Kruger, a GP and deputy chair of the Danish College of General Practitioners, acknowledges the practice and calls it a challenge. Frankly, you could say this medication is being prescribed and used however the wind blows. Pharmacies confirm this too, she told TV2. Kruger describes patients taking half clicks, sharing pens with their partners, and deviating from the standard protocol as the Wild West. While she emphasizes that overdosing or using the drug without proper medical indication is not safe, she sees little risk in underdosing, which is what most people using the method are doing. She cautions, however, that users must be mindful of the pen's shelf life and should not share their medication with others. If patients feel better on a smaller dose, maintain weight, and save money, I don't see a problem with it, she says. Kruger also notes that doctors in Denmark are allowed to prescribe medications off-label if done responsibly. Users speak out. I considered hiding it from my doctor. Helen Fisher, 27, who has struggled with obesity since childhood, started Wegovy in March. She began clicking for both financial reasons and to limit side effects. At her first appointment, she brought it up with her doctor, who was skeptical. I got a knot in my stomach. I thought maybe I'm wrong, maybe this is a bad idea. Why am I questioning the experts? But this is a new drug and I didn't want to go too fast, she says. She increased her dose by just 0.05 milligrams every other week and considered hiding this from her doctor. But ultimately, she was honest, telling her doctor she wasn't yet ready for the recommended 0.5 milligrams dose. The doctor still prescribed the next pen. Helen says she feels safer knowing her doctor is aware of her self-dosing method. She also used an online clinic that provided a publicly accessible click chart and followed that guidance. She's now on 0.40 milligrams per week and has lost 7 kilograms. Lack of evidence for lower doses. Torben Ostergaard, chief physician at Aalborg University Hospital, sees some rationale in self-adjusting doses, particularly for maintaining weight loss or using the drug solely for weight loss. But it becomes problematic if you're treating diseases related to weight, where lower doses might lack the needed effect, he says. Studies show higher doses of Wegovy help prevent heart and kidney disease, but it's unclear how well lower doses work in those cases. There's just not enough evidence. We prefer patients follow evidence-based treatments. Something could arise later that we don't yet know about, Ostergaard warns. He also reminds users that pens stretched beyond their intended use period may lose potency. No regrets. Louise Junge Knoop Flamsholt, 41, has used Wegovy since November 2024 to manage long-standing weight fluctuations. She started on the recommended 0.25 milligrams but soon considered clicking. Though her doctor warned against it, Louise had experience with similar dosing pens in diabetes care and felt confident. Much of her information came from Facebook groups where people post images, label their pens, and share click charts. Despite receiving a 1.7 milligrams pen, Louise uses only 1.3 milligrams and is open about this with her doctor. If she has leftovers, she saves them for the next week. Yes, it's a bit scary that you have to turn to the black market for information, she says, referring to online forums. Still, she has no doubts. I have no guilt. If I were overdosing, maybe. But I'm underdosing. If there's a risk, it's that it won't work. That's on me. So far, she's lost 19.2 kilograms. A blessing and a curse. Jens Meldgaard Brun, Clinical professor at Steno Diabetes Center Aarhus is not surprised that people are clicking their doses. He's seen similar behavior with diabetes and other weight loss meds. But because Wegovy is so well known and social media so pervasive, the scale is unprecedented. It's both a blessing and a curse. Some of what's shared is helpful, but some of it is dangerously wrong, he says. He warns that increasing to higher doses too fast can lead to severe side effects like nausea, vomiting, and abdominal pain. People can get seriously ill. That's why I recommend always consulting a healthcare professional first, Brun says. He stresses that individual agreements between patients and doctors are what ultimately matter. Expensive drops. Since 2025, Denmark's Medicines Council has been responsible for guidelines on Wegovy. It follows only dosages approved in clinical trials and by authorities. TV2 asked Novo Nordisk why the pens allow different dosing if only certain doses are approved. The company said in a written reply, "Our GLP-1 drugs were studied and approved in specific doses for specific uses. We urge patients to follow the package insert and their doctor's advice." TV2 also asked why pens with different amounts of active ingredients cost the same. Novo Nordisk responded, "Our pricing reflects many factors, mainly the medical needs the product addresses and how it compares to alternative treatments. Both Louise and Helen are happy with their choice to go at their own pace using the click method. It's expensive medication," says Louise, "but I've protected my body too." Helen hopes to stay under 1 milligram per week to limit both side effects and cost. "If I can save a third of the cost, that makes a big difference over time," she says. 4 key questions about weight loss drugs. How do Wegovy and Mounjaro work? They mimic fullness hormones, reducing appetite and slowing digestion. What are the most common side effects? Headache, nausea, vomiting, diarrhea, constipation, stomach pain, and fatigue, affecting more than 1 in 10 users. What about long-term use? Weight loss tends to plateau after 1 year. Around 40% of weight lost is muscle, not fat, so physical activity and protein intake are important. What happens when you stop? Hunger returns, food intake increases, and weight usually comes back. The drugs only work while being taken. Eligibility per Danish Health Authority, Wegovy and Mounjaro are approved for adults with a BMI of 30 plus or a BMI between 27 and 30 plus, at least one weight-related condition, for example, type 2 diabetes, high blood pressure, sleep apnea, etc. These medications are not recommended as first-line treatment and must follow a clinical evaluation. While some patients report positive outcomes from self-adjusted dosing, including reduced side effects and lower costs, healthcare professionals emphasize the need for caution. Without robust clinical evidence, unsupervised alterations may compromise both safety and treatment efficacy. For more trustworthy coverage on health and science, follow InfoNews Media TV. And don't forget to subscribe to stay updated.